And now to the latest on the huge surge in COVID cases. In fact, cases in LA County have nearly tripled in just the last 2 days.
Yeah, and the numbers are overwhelming to many who thought that this was going to be a somewhat normal holiday, but then Omicron took off, changed everything, and with that, anxiety levels are going up once again.
That's right, and here to help us is Dr. Galbert, a psychologist and director of behavioral health with Torrance Memorial Medical Center. Welcome, doctor. Let's get right to it and talk about the toll that COVID is really taking on people mentally, especially now that we're dealing with yet another surge during the holidays.
Well, thanks for having me, and absolutely correct. First off, the last year and a half has shown tremendous rates of depression and anxiety, and some of the highest rates that we've seen pretty much ever. And then maybe people thought things were coming down, and then all of a sudden we have this new surge and new virus, Omicron, and again the anxiety about that for many reasons is just increasing dramatically. The reality, anxiety and depression live kind of in the gap between reality and expectations. And I think our expectations were so high that we were going to have a normal holiday, and we were kind of turning the corner on all this. And then when this hit us again with such force, I think the anxiety has risen once again dramatically.
Absolutely. I mean, yeah, you hit the nail on the head. Our expectations and now being pretty disappointed and also fearful. And so those emotional triggers are there, doctor. A lot of people dealing with that. So give us some tips then on how do you get back to a good headspace?
Well, great question. One of the ways, let me first say the way you get into a bad headspace is when we begin to do what I call what if thinking, which is a form of catastrophizing. In other words, what if the variant gets worse, and what if I catch it, and what if my family, and I can go down that road. So when we get into the what ifs, that causes tremendous anxiety. So the way to put a stop to that is to begin to really, if you hear yourself talking about the what ifs and catastrophizing about the future, is literally in your own head, say stop, and then take a deep breath. We need to learn how to breathe, and then ask yourself what is. Because if we begin dealing with what is, we're dealing with the present, we're dealing with the here and now, and what that allows us to do is have much more control of the situation. So we need to basically learn to control the things we can and let go of things we can't control, and exercise that control. We'll feel much better in terms of lowering our anxiety that way.
Let's dig a little deeper in that, doctor, because experts often describe real versus imagined threats and knowing the difference. How does that really apply to COVID?
Well, in reality, in both ways, because this is a very real threat. And again, there's things we can do about that threat, in addition to changing the narrative in our own minds and changing the narrative in our heads. We can do the things that we're been told over and over about vaccines and masks and distancing and avoiding certain kinds of crowds. So there are things we can do. But many, there are the imagined threats, which is, again, when we go off into the future of things that haven't happened. But as far as the real threats, those are very real, and they exist. And again, if we can feel like we are in control of some of the things we are capable of doing, we begin to feel our anxiety begins to lower. We're not in control of things that other people do. We're not in control of things that the universe does, but we're in control of our own behavior and our own actions. And the more we can kind of understand that and be in touch with that, the more we can begin to control that anxiety.
Yeah, great advice. Dr. Galbert, thanks so much for the time, because we know holiday gatherings are already stressful enough just with families. So
great point. I meant to say, even without COVID, you're absolutely correct. Holiday gatherings have their own level of anxiety, and then on top of that, we have our present situation. So,
absolutely. All right, well, we'll chat again soon, and take care of yourself and stay safe.
Thank you. Same to you.
All right, coming up.